o te ao māku e ki atu he tangata, he tangata, he tangata. Tuatahi me atu ki te atua, tuarua, te whare tū nei, te papa ki waho nei, tēnā kōrua, tēnā kōrua, tēnā kōrua. Te mana whenua o tēnei rohe, te ati awa, taranaki whānui, tēnā koutou. Taurangatira mā, tēnā koutou katoa. Ko kurahopo te waka, ko tararu te maunga, ko punahau te roto, ko hokeo te awa, ko kohu tūroa, rao ko kāwiunga marae, ko Ngāti Pāreri te hapu, ko muaupoko te iwi, ko Nathan Joseph Ahau. Tēnā koutou katoa. Kia ora everyone. I don't like standing behind those things. I'm going to walk around a bit. Today, anyone know what I mean? Oh, yeah. It's a touch thing too. Flash, eh? Choice. Anyone know what wari is? It means forgetful. So it's one word that I'd heard explained for dementia, yeah? So today I'm talking about Maori and wari and some of the specific things you might want to consider when you're dealing with your Maori whānau. Whether they're in residence or whether they're at home doesn't really matter that much. It's kind of in the guise, it's cultural competence in another way of looking at it, basically. Because, what we've heard today about dementia, about nursing, that stuff still applies. It really does apply. It's more how do you get it across to your Māori whānau, yeah? So, first thing we need to do is whakawhanaungatanga. Can't do it around the room, so I'll do it myself first, on my own. Just by way of introduction, Ian and I were having a chat. I'm actually from Hastings, grew up there, born and bred. I remember 1972. Growing up in our house was smaller than this room, probably about here. There. 3 bedrooms. There was 7 kids, mum and dad, my mum's parents, and their 4 youngest. 15? That's normal, eh? That's what everyone's experiencing here. Reason being, my grandmother was dying of, what cancer did she have? Renal cell carcinoma. And in our family, mum was the nurse, was the caregiver who looks after everyone. And so when my grandfather died and he had dementia, mum was the nurse again. And going through life, all of my mum's brothers and sisters, my aunties and uncles, they're all rat bags, eh? They all had issues going on. And so at one time or another, they all came to live with us, and there were 16 of them. Sound normal, everyone? We can relate? And so I enjoyed sleeping with my brother's feet in my nose, in the bed. Me and my brother were the first 2 out of our whānau to go to university. Ngāti Kahungunu, as well as Muaupoko. And if you look at my bio thing, there's like 20 different iwi there that I can relate to. When I went to med school, I went to Massey University. And I was married already at 19. And decided to go to university, actually before I got married. Got distracted by the skill. Had a baby, then got married. And then what happened was lived with her and her parents. And then I was working at a pharmaceuticals, which sounds flash, but I actually had worked in the freezing works in Hastings before I moved there, and I was on the table, so my job on the tables, anyone worked in the works here? So my job on the tables was, well, the guys, there's a chain and there's all the sheep going along, and the guys up there would cut out all the hearts and the lungs and all that stuff. So my job was to pick up the lungs and take the sweetbread off and the heart and chuck them down a chute. On the other side, there was a liver and a gallbladder. You pull those apart, you put them down a chute. So that was my job. And the freezing works. Smelled good. And then what happened was, when I moved to Palmerston North, I went to work for this pharmaceuticals, and we got all the bile from the freezing works and we turned it into, what did we get from it? Deoxycholic acid, cholic acid, histamine, and we'd extracted all this stuff. But we were basically the grunts in the thing. So I'd been doing this for 3 years. I really wanted to go to med school beforehand, but I was thinking, gee, I'm not going to be able to do well, there were guys who'd been there for 15 years. This is a long story. The guys had been there for 15 years, and I'd gotten to $10 an hour after 3 years, and the guys in front of me who'd been there for 15 years were on $11 an hour. And I was thinking, that's my future. So, my brother had just gotten back from his mission for our church, and he knew I wanted to be a doctor, and he said, go back to university. I said, I've got 2 kids now. And he said, I can't, man. I'm too poor hard. Have to work for my family. He said, no, just go anyway. So I did. Because he and I were really close. So now at med school in Dunedin, 2 kids, still poor, yeah. My mother-in-law was looking after us, and while we were at med school, had another one. It wasn't until 50 they taught us about contraception. I worked out what was going on. Graduated in 97, went to Palmerston North, worked for 2 years, hated hospitals, hated places. So went off to be a GP over the hill in Masterton, working for the iwi. And started with 0 patients. By August, I had 3,200 to my own. There's 5,000 Maori in Wairarapa. The other 1,800 would have come if I could, but I couldn't do it. It was crazy. Got out of there after that year because a lot of stuff happened. Went to work in Ngāti Porou. From there, we moved, after 5 years working there, went to Auckland because my wife needed some civilization in shops. And now I'm in Auckland. So I've done 14 years working in Māori health providers for various ones. My latest one, I was working for Tūruki Healthcare in Māngere, and I was the clinical director there. And one of the things I noticed was, actually, I had a couple of patients who had osteoporosis. I was like, man, how do you deal with that? Because my patients didn't usually live that long to get that. So I was like, okay, what am I going to do? You know, because I've been speaking with colleagues who used to do the obstetrics, and I've talked about, would you ever go back? I said, no, well, we've lost our skills, don't know how to do it. And last time I did osteoporosis was in my medical run at med school somewhere. So I thought, gee, I'd better go learn some stuff. So I decided to go do some work in rest homes, working for Third Age Health. And so for the last 4 years, I've done rest home work, looking after people with dementia, and learning about osteoporosis. I know how to do that now. And so, like Ian said, I'm not an expert in dementia. But I just know how to look after my whānau, yeah? I'm not an expert in Māori health either, but I've worked with experts. Some of you will know Paratene Ngata, or Tony Ruakere, or Paparangi Reid. Awesome people, learned heaps from them. They're experts, I'm kind of just coming up behind them, trying to lean on their coattails. Now, what's the point of what I've just done? Because I just want to teach a few principles today of what you can do to get on side with your Māori patients. Whanaungatanga, Whakapapa, whānau. This is Dad's 70th birthday. Not in the graveyard. There's Mum's on the other side of there when she died, when she was 49. And my two grandparents are there and my uncle's there as well. And so, been to Dad's 70th, I live in Auckland, all the rest of them back in Hawke's Bay, and I wanted to go visit Mum and have a tangi. Because I miss Mum. My stupid whānau all heard I was going to go, so they wanted to come too, but I want some me time. But when it comes to Māori, that doesn't happen that much. Because if you want to go do something, the rest of the whānau want to go as well. Actually, in Masterton, I just remember a case I had there. Had a patient, Pākehā fella. I think I had about 10 Pākehā fellas when I was in Masterton. Old guy, come to see me first time ever, didn't know who he was. And he had his whānau member with him. And I thought, oh, man, cool. He's got his whānau with him, choice. 3 or 4 times he comes and sees me, I was like, not quite sure what's going on here. And then I think it was like the 5th consultation, he goes, oh, Doc, I think I'm in trouble. Pulls his shirt up, he's got this massive liver cancer. Then when I was in Te Puia, we were doing I thought, gee, I don't know what I missed here. When I was in Te Puia, we did our GP training, and one of our trainers goes up, he says this to us, okay, if one of your patients comes in and he's got a family member with him, that's a problem. It's like, what? That's serious. I was like, what do you mean? He's just got his whānau there. He said, no, that's serious. Because we were all Māori at this time, and Te Puia was going, nah. And so differences in culture, eh? Anyway, when it comes to your Māori whānau, they don't just turn up on their own, eh? Because the rest of the whānau want to be there as well, and they've got to have an argue about it and tell her off for not saying the right thing. And anyway, I don't know why I got the racing guy there. Anyway, so I've got a case. What I wanted to do today, and if you've got any questions, even the whakawhanaungatanga thing, you may be wondering, well, how do I do that? Because it's really important, and I'll show that in this case here.
I don't know what those words mean. Whakapapa, I understand the next one I don't.
Okay. Papa means papa tuanuku, the ground.
Yeah.
So to whakapapa is to place in layers. So there's So if you ever look at the genealogy books that we have, it goes line. So it doesn't do the whole family or anything, it just goes one line. Then for another person, it's another line. So whakapapa literally means to place in layers, but it's your genealogy. Whanaungatanga, establish your family links. It's establish the relationship with the person who's in front of you, yeah, and come to a commonality together. So, case is a 75-year-old lady in one of the rest homes that I'd been working in, and she's got mild dementia, whatever that is. That's what was in her notes. With ware. The nurse said to me, because she was a bit of a wanderer around the facility, so they watched her all the time. But they'd noticed that she'd been withdrawn and depressed. No, she wasn't interacting at all. Maybe 3-6 months before I got there. And that was the story I got. Walked into her room, saw pictures on the wall of her whānau. And it was a family reunion in Cambridge, and we're up in Auckland. Her daughter lived close by in the community, but her daughter couldn't look after her because she had her own 5 kids. And you know how much houses cost in Auckland? You've all seen, yeah. So she's trying to maintain that. Worked out where she's from. She's Tainui. Did the whole thing that we've just done here. And she also loves her church, Seventh-day Adventist. She missed the reunion in Cambridge, where all the family were there. She wanted to be there, because she gets anxiety attacks if she's in the car for more than 30 minutes. Just can't cope. You just freak out. Scared it's going to crash or it's going to die or something. And so I sat down with her after doing the whakawhanaungatanga, which took us, we were just talking forever like I have been right now, you're probably thinking. We sat down for about 15 minutes, just talking relationships, talking who's your family, all that stuff. And after I'd done that with her, I said, we may be able to help you with your anxiety. So I started a low dose of it, just a SSRI. Was that the right thing to do, Ian? Is that right? Okay. Like I said, not an expert. And nurses told me, she's kind of better. And I sat down, she was feeling better. And I don't work for them anymore, but when I last saw her, she'd gone for like a trip for an hour in a car. The important thing to her was getting to see her family and spending time with them. And the other important thing for her is, because of her 7-day events, so she'd go to these conferences, but she couldn't quite get there sometimes because it was too far. So this lady had been in this rest home facility for a few years, and the RN said to me, she's never ever responded to anyone before. So the question is, for you all, was it me who did it? Because I'm flash. By Maori for Maori choice. The only problem with that is there aren't enough Maori doctors to do that for everyone. And that's your guys' job. We've got to do it together. There's actually another thing here, or was it the whakawhanaungatanga that did it? The thing at the bottom. Yeah. I'm now working in Kumeu, not in a Maori health provider, first time, it's a different experience. And I've gone through a lot of emotions actually with it. Because for the last 14 years I've looked after family who've had to wait on a waiting list for 6 months, a year or whatever, or actually don't get seen. And now I've got all patients who have all got health insurance. And they can all get seen next week. And I've been mourning for my patients that I've had for the last 14 years. Does that make sense? Anyway, funny thing happened last week. Had this Pākehā fella come and see, European fella come and see me last week. And he listens to me, thinks I'm from South Africa or something. I've had that lots. From South Africa, Doc? Oh, no. Must be my Flex Me accent. From Hastings. He goes, what's going on? I was like, how do you know that? He goes, I'm Ngāti Porou, Doc. I was like, what? He said, yeah, I grew up in Ruatoria, and we're doing the whakawhanaungatanga thing. Me and him. And I said, Māori, bro? No. But I grew up there. And that's what you did when you're on the coast and you were for those fellas. That's the way you communicate. You develop the relationship. It's what we all do anyway, eh? Except the question is how do you do it for Māori patients? I had one other patient, I thought, choice. Had another lady who, I knew her husband, so I was developing the relationship. Then she complained to me, I'm not here for my husband, I'm here for me, doctor. It's all about me. Which I was like, okay, that doesn't work with these fellas. So, we got the message on that one? Choice? Paratini Ngata, awesome doctor. Died a few years ago. We were at one of our hui atau AGMs for our Māori doctors. And one of the talks we just had at our scientific meeting was on listening therapies. Yeah? And we were listening, thought, yeah, that's cool. Then Pat gets up, and if you knew Pat, really active, all right then, how's it going? And we all loved him. then he started going on this thing. He's talking about, whakarongo, because of the listening therapies. Whakarongo, or growing up as a kid doing kapahaka, what they used to say to us is, whakarongo mate, tituro mate, look at me and listen, right? So whakarongo means, whaka tells you, I want you to do something, so listen to me. It goes, whakarongo, and then it's going, rongo, and rongo means to hear, yeah? Then Pat does this, he goes, rongoa. Rongoa is medicine. So if you're looking at the root word of rongoa, it's about hearing and listening and communicating. And so, rongoa Māori, it's not just about listening, because they give different things, but in essence, if you're Māori and if you hear me and you understand me, then we can get the job done. Yeah? Okay. Man, that's a long introduction. It's got some prevalent stuff here. I think Ian's talked a little bit about it already. Going to talk a little bit about models of health for Māori. And some of the aspects of care that you need to consider for your Māori whānau. And I've got a couple of cases there, because I like using stories. It makes it a bit richer instead of just, this stuff. So that's the age distribution for Māori. We all know that stuff, 15% of the population, heaps of young fellas and not many old fellas. But that's improving, because we have lots more kids than everyone else. How many did Mum have? 16? Yeah. I've only got 5. I'm the slow one in my family. My sisters had 9 and the other ones had 8. And so 15% of the population, and our mean age is 24. At my practice at Turuki, we worked it out. 95% of our patients were under 45. Okay. Whereas this one looks a bit different. 74% European population, mean age 41. I had a look at the figures. I thought I'd better actually have some stuff up there that looks flash. 80% of Māori, if you look at the 2006 census, were under 45. I couldn't get for this last 2013 one, whereas 60% of non-Māori. And when you're looking at our population, we're kind of interested in here today. 4% of Māori live to over 65, whereas 14% of non-Māori. Then, if you look at the stats, we're 15% of the population, but we're quarter of the population in the under 5s, and 2% of the over 80s. So we're doing this. So these are estimates, but they reckon 48,000 people with dementia in 2011, of which nearly 2,000 were Māori, or 4%. And 2% of Māori were resident within rest home. And those are the predictions for 2025. It's going to be lots more, and our numbers are going to increase. And maybe going to make up 7% of those with dementia. And what's that? That's like 200, 300% or whatever increase in Māori. So, and just like my patient who I mentioned at the start, there's a lot of stresses on Māori whānau at the moment. Everyone's struggling, Everyone's struggling. But because we're at the bottom of the socio-economic rung, we're struggling lots. And so it's always been traditional for us to look after our family in our homes, always. But because Mum and Dad are going to work now, my mum isn't at home to look after my grandparents anymore. And so that's a consideration that's going to have to be taken into account, especially for those who are planning rest homes, and also those who have got run rest homes, consideration of how do you look after those Māori coming through. Types of dementia, I just put that to look like I knew what I was talking about. Alzheimer's and vascular, probably that's the ones, and the alcohol ones as well. Now, like Ian said about risk factors, and these risk factors are why Maori are doing that. Okay? It's the same stuff happening in the young ages as what's happening in the old ages. Mental health, trauma, our young fellas killing themselves in car accidents and suicide, and substance abuse. I had a friend who was selling marijuana when I was at Flaxmere Primary when we were 8. Yeah. Just putting it in context, you know. They had a flash car, those fellas. They were on the dole too. Anyway. The risk factors for cardiovascular disease, yeah. Ian's already mentioned it. That's Māori's lives. And so we've only got 4% that we know of, but there's got to be more than that, eh? It's got to be more. And so the whole thing about early diagnosis. So the question is are Māori presenting for diagnosis? One question. Second question is, if they're not, why not? Okay, another case. 70-year-old male patient of mine, forgetful. This is my first run when I was in hospital in 1997. And I'd been in the geriatric ward for 2 months. I'm into my last month because it's 3-month runs, eh? And then you move to the next one because you're an expert in that now. Or you go round and round and do it a few times before you get good at it. He'd already had some dementia. This was his 3rd stroke, I think, that he came in with. Totally dependent, wheelchair, needs feeding, everything. Hemiplegia, dysphagia. Ooh. So I'm sitting there in the hospital, my first run. I'm trying to make a good impression with my consultants. And this is the first Māori I've ever had in there. I'm like, oh, cool. And for those 2 months, I'd been shown, okay, you take care of their bowels and you make sure they're sleeping and, you know, all that stuff. And then you do the social thing, and inevitably for most of those patients who were in our ward, they went on to a rest home, yeah? After they had all the assessments, because ours was a chronic ward, and they've been sitting around in the hospital for ages. Then we got them for ages more before we put them in a placement. And so that was the way I was trained. Oh, this is what you do. This is normal. So I said to the son, who's coming and talking to us about stuff, oh, well, we need to do this and this. He goes, oh, I could use a different word. Oh, hell no. Used a different word, one of those other ones. I'm taking him home. I was thinking, dude, you see how dependent he is and how hard it is? And no, I'm taking him home. It made me remember, don't forget who I am as Māori. And also, don't forget who he is. Being Māori, his whānau have different expectations of what is my pathway next. Okay. Let's talk about reciprocal care. That's my beautiful wife and her mum. 77. What do you reckon? Awesome, eh? There's a little bit of Photoshop going on, but just a little bit. I think every 5 years my wife gets these photos done. She looks better every time. Anyway, so those years I was at med school, remember I said we were really poor? When I was in 3rd year, Mum had lung cancer, my mum. And I sent my family home to be close to Mum. So I got depressed. Been there 3 times, so I know what my depressed patients feel like. That's good therapeutically to be able to talk with them about it. Anyway, this woman looked after us. Made sure her mohos didn't starve. Made sure they had clothes. When the snow came down in Dunedin, she sent us some money to get a heater. And she did it. She just looked after us for years, till I could stand on my own 2 feet. For Maori, it's not an expectation you're going to do this, but I've fed you, I've given you aroha, I've looked after you, and so the expectation is on us. This is me and my wife's thinking, she's not going in a rest home, she's staying with us. No way in hell is she going there. We've heard that before today, eh? And she's starting to get a bit doddering now. Yeah, that's a polite word. I did a mini mental state on her the other day. Wrong tool. Oh. And that's the expectation. Now, if you're a family who's struggling financially, but the expectation is from you that you're going to look after them, but you can't, and that's the cultural and traditional thing to do, it's hard. It's very hard. Let me put a proviso on this. Not all whānau are the same. Not all Māori are the same, so can't generalise. And the world's changing, eh? Māori are marrying non-Māori, and one of the things I noticed in the practice I'm in is you have these brown fellas walking in, they're listed as Pākehā. I'm going, do you guys do anything about ethnicity recording? And they went, and what had happened was the mother's Pākehā, the husband's Māori or Samoan or whatever, so they're Pākehā. And that's what they wrote in. I was like, oh, okay. You might want to do something about that. Anyway, went off on a tangent. Do that often, sorry. So, I mean, there's a lot of whakamā. We all understand that word. It's a concept that denotes shame, embarrassment. I failed in my responsibility. For Māori whānau who have to put their family into a rest home, and so a lot of them will hold on and hold on and hold on until they can't do it anymore, and then you're going to get your elderly Māori patient who's really bad, instead of actually having sought the services earlier. She's staying with us forever. I've been queuing my daughter up. Hey, I come moving with you, eh? Yeah. Actually, I spoke with my wife this morning. She goes, I hope one of them wants to take us. And this isn't necessarily different to a lot of other cultures, eh? It's not. And don't get me wrong, I'm not saying everyone else doesn't do that. So some words for your whānau. We all think that's family, eh? But it actually means it's birth. And to give birth. Strong words, if you understand what they mean, especially the connection that gives you with your family. Hapu is to be pregnant. That's also your clan or your tribe, so the wider family. Iwi is your bones. It's in your bones, you know. That's, me and Lancy's more opoko, we're bones. Choice. And so you develop these close bonds. And so once again, it's that whole thing about when you're talking about wareware and dementia for a lot of our Māori patients, a lot of us it's not well understood amongst a lot of Māori families. Not all. Some are pretty good. But when you say that word to them, I mean, I remember the first time a doctor diagnosed someone in front of me as a medical student, they said, he's demented, he's got dementia. And I was like, how dare you say that? What a terrible word. And for your Maori patients, they're going to have that same reaction. And the feeling that they're going to get from that is, you're trampling on my mother's mana. Yeah? And so you're giving me a label that it's stigma. Yeah? You're stigmatizing me by giving me that label. It's a word, if you're talking to kids these days, they think Harry Potter and those things that are flying around. Hey, terrible things again that are going to suck your life out of you. Spoke to my wife, she said, oh, it's a zombie. It's not well understood. And because of the misunderstanding, once again, not going to present. But did anyone read that 180-page thing I sent to you fellas? I'm sure all of you did, eh? There's a link that was sent out, I think. And it's actually a master's thesis on Maori and dementia. Awesome read. Because I can't go through everything today, but I suggest if you want to really hone down into what I'm talking about, have a look at that link. It's a beautiful read. Anyway. For a lot of Maori, we think it's normal to get forgetful. Like Ian said, it's normal. Oh, she's just getting cantankerous. Just a bit of a hoha, we can deal with it. Hoha, pain in the bum sort of thing. And the diagnosis of dementia, I've already talked about that. I've said that one already. And that. And that. Not all Māori once again, but sorry. I'll move to this side. Some people think, surely people don't believe that stuff. Hey, but there are some whānau out there who believe that my mum's got something, either because someone put a makutu on her, a curse. Yeah? Or they've transgressed the laws of tapu and noa. You guys are going to have to go away and research that stuff. Rules that you don't want to break. Because in the old days you got mate Maori, which is a disease, an illness from doing something wrong, and there was no cure for it. You died. That's what Elsden Best and them talked about. These guys would do something wrong, and then they'd go off and they'd die because something had gone wrong. And then other impressions of it is that they're matakite, seers. And so it's seen as a desirable thing because they're in touch with the tipuna, the people who have gone beyond the veil. Yeah? And so all of these different, now once again, not all Māori, then like Ian said, there are others who go, oh man, I think it's dementia, can you help us? One of my senior colleagues, he said to me, because I was talking about psychosis and this stuff, he said to me, what I believe it is that the te arai, the veil, the veil between this world and the next, is thinner for those people and they can hear the people calling to them. So it's not just amongst our Māori whānau, it's actually amongst our clinicians as well, that some of us believe that. And so Māori very in touch with spiritual things, so some of this stuff is actually normal. And if you believe it's normal, you're not going to do anything about it until... So tolerate these normal behaviours. And generally, you'll go to your tohunga or your minister. I had one lady come to me who had diabetes. How much time do I have? 12 or 3. Oh, okay, man. I'll put that one away, that'll take too long. But, no, I had a patient with diabetes. Sat down with her and tried to get her on insulin. She didn't care. She was 70 or something. And I tried to talk to her, your HbA1c is 200 or whatever it was really high. Anyway, after the third visit, she said to me, because I thought, better go back to basics, whanaungatanga, Ngāti Porou. And then it comes out, you know, doctor, my priest said to me, I'm going to go to either heaven or hell. And my tohunga told me I'm either going to go to the East Cape, then I'm going to go to Te Reinga, and then I go onwards. Which one is it? So she wanted to know about the spiritual things. And I went, so I just shared with her what I believed. So we had a big talk about that. At the end of it, she goes, man, I'm mimicking all the time. She's peeing all the time. And then I said, well, you know, if we put you on some insulin, you'll probably be able to pee less and sleep better. He goes, oh, choice, yeah, let's do that. Oh, going back to basics, okay. We all know the stuff, eh? Whare tapawha. My wife said, don't talk to them about that, they already know that stuff. But there's other models. And sometimes we get stuck in the biomedical, biopsychosocial stuff, and we don't consider outside that. And that's what these are about, being a bit more holistic. And I had a look at that review of New Zealand Dementia 2011 and said, yeah, the world is moving that way. Eh? You've got to go that way. And the nurses are awesome at it. A lot of us doctors need to. Anyway, so we all know about this. I think I've got another patient now. Yeah. Go back to that. Taha wairua. Do any of us ever consider that when we're talking to our patients? Have you ever asked your patients about that? Question for you. Just think about it. Because, you know, we know to ask about the mind. We know to ask about the body. Do the blood tests. Do the mental state. We know to ask them about their family and their social situation. So I had this fella. He's got a bit of dementia, depression, anxiety, mild again, whatever that is. He's at home withdrawn again. Like my first patient, being on SSRIs, I'd sat down with him and I did what I did with that first patient. Didn't work. And I said to him, well, with the whānau there, because they all come along, like I wanted to go to the grave on my own. I said to the whānau, well, we've dealt with the tinana. That's not got us anywhere. We've dealt with the hinengaro. We're doing the SSRIs and we've been talking to whānau, and I said, what are you doing for your wairua? What do you do spiritually? Oops. Turns out he actually goes to the church I go to, but he hadn't been for like 20 years because the family don't belong to that. So I said to him, because he used to enjoy that as a younger person going, because that's what he was brought up as. So I said to him, look, I said to the family, why don't you take him to church? To take the sacrament, to mix with the people that he knows, because there was some of the older fellas still at church. And they were already kind of doing that, but he hadn't had his spirit looked after. And a couple of months later, anxiety, depression, all that stuff disappeared. So we stopped that, and he was still okay. And so, cha-ching, happy. You know, because a lot of us look at those models and go, well, how do you apply that? Hey, how do I ask him about his spirituality? How do you talk to him about being demented? This is one of the other models. Gee, I haven't got much time at all. I'm not going to get through any of this. Maybe I'll do this, and then I'm just going to show you some slides. Because we've got all that stuff, we know that. Some other models have said land is very important when it comes to Māori health. And I know we can't do anything unless anyone wants to buy me a plot of land on the Coromandel. Beautiful. I'll take it. This whakatauki is a proverb, a saying. He wahine, he whenua, e ngaro ai te tangata. for women and land, it's been interpreted this way: for women and land, men go to war or die or are lost. Different ways you can look at it. At least that's the way I'd heard it. You know, that makes sense, eh? Your men are going to get up and look after your family, and they'll die for them. And I was sitting in a class once, and one of the Alkuya told us this interpretation of it. And she said, well, if you look at the word whenua, whenua actually has double meaning. Whenua is land, but it's also the placenta. Yeah? And just as men come from the whare tangata, from the woman, yeah, and are nourished by her and the whenua, the placenta, so our health isn't going to be well unless we're actually still nourished by our land. Does that make sense? Yeah? And so the tradition is, this is my son, I took a photo of him yesterday because the other one was blurry. I said, come on son, let's go take a photo. We'd been carrying his placenta with us for the last 14 years because we forgot it was in the freezer. We were supposed to bury it at Mum's place. Oh, sorry, Aaron. Some of the kids nearly ate it once. Anyway, very important. 4 other kids, they got theirs in the right place. Quick. Anyway, and what you do is you take the placenta, you bury it in the land, you put a tree on it. I don't know if the tree is the traditional thing, but it's something we do now. So that's his tree. We planted that a year ago. And so it ties you to the land. And you are healthier with that relationship. If any of you have been to Wanganui, there's a saying that they have there, ko au te awa, ko te awa ko au, which means I am the river and the river is me. And a lot of you remember that Motua Gardens things, eh? And, well, Wanganui have now got their river back, eh? And the joy that those people have. Not just because they've got an economic base, but they can now nourish their river again, and it can nourish them. And it makes them feel whole. And so what they do is they all go for hikoi up the river to heal themselves, to feel better. One of the Ngāti Porou ladies said, my tohunga told me there's a spot, a bend on the Waiapu River, you go there, you wash yourself, that's where you go to get healed. So there's these beliefs out there, and that's how a lot of our whānau feel whole. And of course, a lot of you won't know that stuff, but when you're dealing with the whānau, the important thing is get the right people on side with you. So if you've got a rest home, get some Maori consultation for these families who are coming through. And I talk too much, sorry. That 180-page thing that I told you about, it addresses the history before and after, and it gives suggestions on how to deal with all of that. And honestly, awesome read. I really, really enjoyed it, so I encourage you all to do that because I ain't got any time left. But it gives you a lot of suggestions how you can improve your practice, how you can improve your rest home, how government might want to look at it. Of course, government have their own things, but these were the five things that they noted as the big 5 within that masters. So have a look at it. Test. Apparently that one's culturally not good, according to some stuff I read. So I was like, well, okay, I've been using that all the time. Far out. And educationally, it's not that great either. If you haven't been to school that long, and a lot of my friends dropped out at 12, so they're probably going to fail some of those lines already before you even get to the dementia. I'm just going to flick through all this stuff. Sorry. Last one. This is my final point. This is my great-great-grandmother. ahu mai te pairata. Any of you know the story of Orako? The Battle of Orako? Heard of it? No? Okay. I'm proud of her because she was the one who stood up on the parapet because Major Mayor said, you know, to the men, you know, we're going to kill you, you're going to die. How about giving up and it's all good, basically. And one of the men said, ka whawhai tonu mātou, ake. We will fight you forever. Or we will continue in the struggle till we get what we need. Yeah? And then he said, okay, pai tēnā, that's fine. And then he said, but let the women and children go. Then my great-great-grandmother got up, found men die, we die too. Getting emotional, sorry. Yeah, wasn't quite sure if I should put her on here talking about wari. Anyway. This one here, naku te raudo, no te raudo, ko orai te iwi. And I think this is the sentiment of the Treaty of Waitangi. And it's also it's also the sentiment that we need to take ourselves when we're talking with our Māori patients. It says, with my basket and your basket, together the people will be whole and well. Because Ian's flash, he knows all this cool stuff, how to look after dementia patients. And aroha, and our nurse also knows this awesome stuff, and PHARMAC's got all these awesome tools. And we have our tools as well that I've kind of talked to you about. Bring those together, and that's how you look after our whānau. Kia ora, tēnā koutou katoa.